In this video, I'm going to review with you how to return to work right. For many of you who've suffered a concussion, a traumatic brain injury, or a stroke and want to get back to work, there's a way to do it safely without increasing your symptoms. And so that is what I want to cover in this, is the fundamental principles of how to do that. Depending on the length of time you've been out of work, you may need to go back to work at 4 hours a day. Now, for those 4 hours, you may even need to take a 15-minute break each hour. As we talked about in the exercise video with how much physical stimulation you want to do, the same thing is true with going back to work. For example, if you can work 2 hours and at that point in time you develop a headache, brain fog, light sensitivity, then what you want to do is 80% of that. Or let's just say an hour and a half. So you'd work an hour and a half and then automatically have a built-in break before you get symptoms that appear or increase. Now, once things settle back down and you know you're feeling good, then you can go back and do more work. It's recommended that you handle 4 hours a day for the entire week, and then the following week you go up to 6 hours. One of the traps you can fall in is each day you get a little bit more drained, and then you try to increase it midweek and you tank. Now, there are times when this can be okay, but normally on Wednesday you are feeling perfect with no issues at all. In that scenario, it is okay to go to 6 hours. And so really the goal is to get back to full time after about 3 weeks, and then shortly after that to be able to go full time without any restrictions. Now, depending on your individualized case and your needs, we will work with you to make sure you get back to work in the appropriate way. Because, for example, those of you who work a lot on computer screens and have to do multitasking may find you need more breaks because of all the electronics and the brightness from the screen and the multitasking that you put through. Whereas others that don't have that often can go back to work at a quicker rate. So, once again, if you have questions on how to go back to work, let us know. This video, though, is a good starting point for how to do it. Remember, don't push through your symptoms, because if you do, you may notice a regression and not have the recovery that you're capable of.